Hi, this is Dr. Johnny Liu from Doctor's Choice, and today I wanted to talk about the uncomfortable topic of rising healthcare costs and what's really driving it, or one of the biggest issues that are driving it. And what's happening is that the number of doctors, if you look at the graph of number of doctors hasn't increased significantly in the US. In fact, there's a doctor shortage. There's all these things talking about let's get people from overseas without the US medical training to be able to take care of the US patients because there's a doctor shortage. And what you have is a astronomical rise in the number of healthcare administrators in the system, which are eating up a lot of costs. And a lot of times I'm wondering, they're great folks, but whether or not those positions are necessary. So the US healthcare system is about a $5 trillion market. This was data about a year or two old. And out of that trillion, there's all these different studies about what's the administrative burden, administrative waste. So there was a study on health affairs where they compared Canada. Everybody loves to compare these nationalized healthcare systems. There's always pros and cons. That's why people from Canada come to the US to get care sometimes. And they're saying that on the same ratio, if you had a nationalized healthcare system, the US would save anywhere from, it's a big range, anywhere from $200 to $600 billion a year in administration costs. So that's roughly 15% of the overall healthcare spend, which tends to be the increase every year on healthcare spending. And then also, if you look at administration as a whole, healthcare administration takes up about $1.2 trillion out of that $5 trillion market. Just to give you a comparison, doctors as a whole get paid about $1 trillion out of the system. So hospital administrators make more than all the doctors in the US. And I think that's to be concerned. That's concerning, because if, let's say, you go to the restaurant and you swipe your Amex, swipe your MasterCard, the administration of that meal, if the meal was $100 and it costs $50 to administer that meal, and the restaurant gets $50, then things would get a lot more expensive. And that's what's happening in healthcare. So I think one of the areas and it's unpopular, right? Because a lot of the administrators are the ones that make the rules. So of course, they're not going to say, well, let's cut our jobs. Let's cut hospital administrator jobs. Let's cut practice administrator jobs. Maybe we can automate some of these positions. And maybe we don't need to make things as complicated and have all these authorizations and have these back and forths. And it's not just on the provider side of the thing as well. It's on the government side and on the insurance side. So I really think that if we can pay attention to the administrative costs in this country, we can potentially significantly drive down costs, but more importantly, increase the transparency as well as the accessibility of healthcare. Make things simple. Right? At Doctor's Choice, our goal is to make healthcare easy to understand so that people can make an educated decision. When you add layers and layers of complexity, which you need to have an advanced consulting degree. I don't know if they have advanced consulting. You have to work for one of these big three consulting companies in order to understand how to just simply go to the doctor. I think we have a big issue here. So that's the first step to look at solving the problem, which is, can we cut down on the administrative costs and the administrative burden in healthcare? Because that's not going to significantly affect the way that healthcare is being delivered. And in fact, it may open up avenues where healthcare is going to be delivered in a much more effective manner.